Good afternoon. Hi, my name's Ashley Harper, and today I would like to tell you a story. It doesn't involve dragons or castles or evil magicians, but it does have a villain, a hero, and some cool graphics. So sit back, relax, and enjoy the ride. So on my adventures to become a data analyst, I have encountered many exciting realms. Over the course of the last few weeks in BA 513, I have been introduced to RapidMiner, a data science software platform that provides an environment for predictive analytics and machine learning. Next, I encountered Tableau, a data visualization software. And this is where our main story begins. The story that I'm going to tell you today involves a mom and her son. So about 3 years ago or so, my mom was diagnosed with Alzheimer's, and she was living with us at the time, lived with us for a little while after that, but unfortunately, we had to admit her to a long-term care facility. And so that was tough. Being a devoted son, I missed having mom around, being able to pick up the phone and give her a call. And so fortunately, we were able to visit her every day and have that interaction, so that we could stay close. But then in February of 2020 last year, COVID-19 struck. And COVID-19 was terrible for the long-term care facilities. Cases began to rise dramatically in the long-term care facilities. As you can see in the charts on the screen, week over week, you had a little bit of an ebb and flow until around December of 2020, when the cases continued to spike dramatically across the country. And it finally reached a peak toward the end of the month in December of 2020. And slowly we have been seeing that trend downward. So in Kentucky, where my mom resides, she is in a long-term care facility with about 75 other residents. And the week over week caseload in Kentucky actually wasn't too bad for several weeks from say May to October, November, nationally. As you can see on the slide there, the number of cases per week, week over week, confirmed cases per 1,000 residents was about 3.09 cases per 1,000 residents in the state, which overall, like I said, not too bad, a little bit below the average, the national average. But the villain COVID, it finally struck the long-term care facility that my mom resides in. And like I said, of the 75, 80 residents, practically every single one of them eventually tested positive for COVID. They had a 100% positivity rate for a period of a couple of weeks. They actually had about 3 deaths over those 2-week period of time. And then, like I said, that led into from November into December, when the number of cases peaked nationally. So the number of deaths from the long-term care facilities versus the remaining population, as you can see on the charts, it's kind of astronomical, right? You have the residents that are confined to their beds, staff coming in and out. They may not have had the appropriate PPE. There were a lot of factors that affected the COVID cases, the positivity rate, and the deaths. In the state of Kentucky, you can see, like I said, that the trend spiked in the end of December. And luckily, we've had a couple of vaccines, now a third vaccine that has been made available. And so it was around the 1st of January that my mom, the hero of the story, she actually survived COVID with very few side effects. She lost her taste and smell for a while. She didn't have too many bad symptoms, luckily. So, like I said, she was the hero of the story. There were several folks that weren't so lucky. And, the number of deaths in Kentucky, like I said, reached a peak in December. And luckily, the new year brought a couple of new vaccines, 3 new vaccines total. And so we're seeing that trend decline significantly. So the good news is the cases are on the decline. The vaccines are coming around. There will be the 3 vaccines that are available and distributed across the country. By May, our president says that he should have enough vaccine for every adult in the United States. So that is a huge win for us. So luckily, the decline in cases means that the long-term care facilities will be reopening soon. So I will have the opportunity to get to hug my mom again. It's been over a year now since I've had any physical contact. I've got to see her through the glass door, talk to her on the phone, but it's just not the same. So with that, I would like to say thank you so very much for going along on this little ride with me today. I hope you enjoyed the story, the graphics along the way, and I thank you for your time. Have a good night. Bye-bye.